It is just a huge honor for me today to be podcast interviewing Dr. Katie Lee, a dentist, speaker, author, and coach who lives in Aurora, Colorado. Dr. Lee graduated from University of Illinois at Chicago in 2010 and was an owner partner in over 80 DSO-supported dental practices throughout the U.S. and served as clinical partner overseeing 5 states. Currently, she consults for health technology companies and provides implant education for general dentists. Dr. Lee has 2 passions in her profession: dentistry itself and making other dentists successful. Her passion about oral systemic health link comes from personal experience. Dr. Lee was involved in an ATV accident as a teenager, which left her without many teeth and rendered her jaw immobile. She experienced how oral health affects systemic health and the benefits of dental implants. Her firsthand journey in recovering from the effects of dental trauma led her to specialize her career on the mouth-body connection and dental implants. Dr. Lee searches for proven technologies that improve clinical outcomes and the patient experience and loves to educate her peers on those technologies. Dr. Lee authored a book entitled Saved by the Mouth to educate patients and clinicians on the importance of oral health. And by the way, I on that Amazon, all your reviews are 5 stars. You don't have
Thank
one
you.
4-star. So I'm gonna buy the book and give it 4 stars just so you have
No,
one.
no, don't ruin my streak. And all those reviews are totally organic. I didn't actually ask, like, they're not friends and family. They're all organic reviews, which I'm really proud of.
When I came out with my book, I made all my family right.
I should have. I probably would have got more publicity if I did that, but
Dr. Lee has won many accolades, including top 40 under 40 dentists in America and International Woman of the Year in Dentistry. She has been featured on local Fox and NBC news stations discussing the importance of oral health. Um, can I call you Katie, or you want me to call you Dr. Lee? Or
Katie, please.
Katie, I retired and I sold my today's dental and the land and building in my house, and I did it after the pandemic, and I was scheduled to lecture, forever. And it got me off the lecture circuit. I finally had an excuse to cancel them all. And I took 4-year break before I let them schedule me for just a couple. But the reason I started the podcast up is because, Katie, every email I get is the same. It's their 2 or 3 years out of dental school. They got a $300,000 to $500,000 in debt. They're working for a DSO or their associate somewhere, and they don't feel they're getting any respect. You know the story, but they're not happy. They're miserable. They say things, well, my sister became a nurse. I should have became a nurse. She has no debt and she's making better money. And so I thought, oh my God, because it's challenging times. I mean, we just had a pandemic. That's a once in a century. Dental schools are raising if they raise their price $10,000 a year, it doesn't affect applicants. So the prices are skyrocketing. They're opening up new dental schools. My gosh, talk to that dentist. I mean, she's mad, she's frustrated, she's like, what the hell did I do? And you're smiling because you lived through it too. So talk to that girl. I mean, what would you say to her?
First thing I would say is some tough love. Put your big girl panties on and your high heels and go get to work. I graduated in 2008, and that was in the middle of the Great Recession. And my whole plan was to take over our small town dental office. I was a dental assistant there for 6 years, and I was supposed to go back and take over his practice so he could retire. Well, when the recession happened in 2008, I graduated in 2010, excuse me. When the recession happened in 2008, everyone lost all their money. So all the dentists that were supposed to retire couldn't retire anymore. And not only that, but people stopped going to the dentist. And so they didn't need to bring on all of these associates. And, at that time, I had put myself through undergrad and dental school. So I had an enormous amount of debt. And when I applied to work, I sent out over 50 resumes, and it was by mail back then, not email. And I was number 2 in my class, and I could have specialized, but I was just really afraid by the amount of debt that I had and just wanted to get to work. And I only received 2 interviews out of those 50 resumes. And one was for a pediatric, it was a GP dental corporation that served kids. And then the other one was for the DSO that I ended up working for 13 years. And when I graduated school, I was always taught, don't you ever work for a dental corporation. It was even more taboo back then because more docs were still in private practice. But, I just kept thinking to myself, I chose this profession for a reason and I'm going to find a way to make it great. And so when people come out, and they're kind of whining about the circumstances that they're in, we've all been through hard times in our life. And it's just, you really got to stop and think like, am I going to be a victim and succumb to my circumstances? Or am I going to grab the bull by the freaking horns and figure out how to make it successful? So, dentistry is it's I always think it's never been better. I say that every year because now dentistry is actually starting to be recognized as a health profession. So we're starting to get more notoriety and recognition from all types of patients, and we're getting more recognition from the medical community. So we have this really incredible opportunity to not only serve patients' oral health, but help connect their oral health to systemic health. So it's a great time to be in dentistry. Don't worry about the debt. You'll be able to pay it off. Just live within your means and you'll get there.
So on this DSOs, where do you think it'll be in you graduated in 2010, it's 24. Where do you think it'll be in 20 years? I mean, who do you is what happened to pharmacists at Walgreens and CVS happening to dentistry?
I mean, I'm not a market specialist, but just from what I've seen, DSOs are way more common now than they were back then. And everyone's kind of going into the DSO market. Private offices or private practitioners that maybe had one or two locations are starting to get into the DSO space or turning their offices into DSO. The other thing that we're facing is a lot of people are wanting to retire, and what I've noticed, especially owning my own practices for several years, is that the dentists coming out have so much debt and or they've lived through COVID and don't want the stress and the responsibility of being a business owner. So they really just want to come on and work as associates and not own businesses. So I had a really hard time the last probably 3.5 years of my career trying to get people to partner with me and buy. And so what's happening is all these docs that want to retire and sell their practices have no one to sell it to. So they're ending up selling it to DSOs or private equity. And so we're seeing this huge influx of private equity into the dental space. It's already happened in medicine, but it's definitely coming in dentistry if it's not already here. So I do think it's just the DSO market's just going to keep growing.
Kroger, when they rolled up all the state's grocery stores, they let them all use their own name.
Mhm.
Like in Kansas, it's Dillon's, and Arizona, where I live, it's Fry's. I Heartland did it that way. They're all different names. I think Heartland is going to be Kroger, and PDS. They also have all these different names. So I think Heartland and PDS will be Kroger. Aspen's got to be the Walgreens. Who do you think will be the CVS?
That's a really good question. There's so many good ones that are on the market now that are growing. So Smile Brands is a really big one. They're kind of I really see Smile Brands as like a kind of like a PE acquisition type of company more so than like a dental company. I don't know much about it, so I'm sure I'll get, backlash for saying that. But there's really other good companies out there like MB2 is coming up, DECA's coming up. So I think, it's fair game to see who's going to come up and be the other one. Affordable, has really cornered the market in terms of dentures and implants. We know so many people need implants these days, especially as our population is aging, and they've done a really fantastic job at kind of cornering and capturing that type of market. So yeah, I think it's fair game.
And it's funny because when Clear Choice came to Phoenix, all the oral surgeons and periodontists had their, panties up in a knot. And it's like they advertise so much. I mean, every day someone's saying, I watch this infomercial on TV. And I mean, it rose the whole market. And
Yeah.
these guys will go work at like Heartland for 2 years, and all they'll do is whine and complain. I'll say, well, tell me, Rick owns 2,000 offices. What did you learn? They don't know the codes to do an insurance claim. They don't know any of the accounting. I mean, it's like, oh, so you just sat there and sulked for 2 years of
And
the bad
complained.
attitude
Yeah.
when you could have been an apprentice to Rick Kirschner. I mean, Rick Kirschner owns Comfort, but Rick Workman, owns 2,000 offices. You couldn't have a great attitude and be grateful and learn everything. I mean, life is such an attitude. You know what I mean?
Totally. I agree. And Clear Choice opened in Colorado. I think the
Oh,
first
that's
one was,
right. I
yeah,
podcast
was
with them.
in Colorado Springs. And I remember, the first thing I feel like anytime something new comes to the market or trying to change how we do stuff, the first thing is always fear and pushback, right? Everyone gets really afraid. What's this going to do to me and my business? And the ones that succeed are the ones that dig in. And as you said, start to learn and try and figure out what they're doing. I really appreciated Clear Choice because I didn't do any media marketing whatsoever. I did online pay per click some super organic social media, but that was about it. But all of my implant referrals were second opinions from Clear Choice. And, every dentist should love a second opinion, because if you can't, win the second opinion consult, then you're really doing something wrong. So I actually appreciated all the marketing Clear Choice did. And then Renew, which was the overdenture spinoff from Clear Choice, opened up right down the street from my practice in Aurora. And so they were going after the overdenture market. And so that was a chance for me to see what they were doing and figure out if I could match or do it better. And I actually became really good friends with the office manager at Renew and figured out that they had a super cookie cutter way of diagnosing and treatment planning patients. And a lot of patients didn't fit their model. And so the manager actually became my patient at my practice and then referred all the patients that they couldn't treat over to my practice. So there's a way for all of us to be successful. I don't think we should ever be fearful of what's coming. We just got to figure out how to, work with it.
And a lot of these dentists, another question that when they're working in DSOs, they're asked to buy in, but it's not publicly traded and they have a minority partnership. So if it's not publicly traded and you own less than 51%, you're at the mercy. You have no power. What do you think of these people that say we're owner operated each store, and they're asking this young, she's 1 or 2 or 3 years out of school, they're asking her to buy in. Do you recommend buying in when you're a minority partner? And plus, why are none of them publicly traded? I mean, look at all the batshit crazy companies on the Russell 2000 and the S&P 500. No profits. I mean, things I'll never need. And then here's dentistry. You have to have, everybody on earth is going to see a dentist
Yeah.
one day. Why do you think none of them are publicly traded? And would you recommend buying in to these DSOs as a minority partner associate dentist so that you can be an owner operated?
Yeah, that's a great question. And I don't know if I'm totally qualified to answer, why I don't think they're publicly traded. Um, there is a large influx right now of private equity money. And so I don't think at this point they really need the extra cash to go publicly traded, in the future, probably. But when you start going publicly traded, right, you got to start answering to a bigger board and answering to the dividends and the profits and things like that. Were you going
But
to say?
I think their obvious problem is dentist turnover. I
Mm-hmm.
mean, it's hard to find anybody that works at a DSO that's been there longer than 1 or 2 years. And I would just think that if they were getting company stock and they incentives matter. I mean, and economic
That's
real number one
that's
is
actually
incentive.
a brilliant idea that I've never thought of. Instead of having the docs buy in, just give them stock, because that is one of the models of the DSO is to buy in at a minority stake, or a lot of the models are to have docs buy in at a minority stake. And part of that is, at the end of the day, no, you don't have control over your practice. In my own personal experience, what I experienced was, as long as my practice was running well and my patients were happy and my team was happy, I didn't really have any sort of outside influence, which was really great. But as soon as the business starts to suffer, you're not growing, of course they're going to come in, and try and make things better. And that is, I can see that as a positive, because you and I both know there's a lot of dentists out there that are horrible business people. And so they do need some additional help. But that, I really see the buy-in of the minority partner, like what you're saying, in terms of giving them stock options, right? It's basically a tool for retention. You're not a real practice owner. You're not a real owner doctor. You're there for retention, and you get to split the profits at the end of the day on the work that you do, which is really enticing, and you can make a ton of money that way. And so for someone coming out of school, I would definitely look at the model, and I would look at the other docs in the organization that have bought in and see if they're happy, and see what kind of success that they've had in terms of determining if they should buy in or not, and then figure out what is the exit strategy. Because as you said, turnover in this game is really high. And just because you buy in right out of school, in a few years, your plans may change. You may need to move out of state because your spouse gets a job, and you need to know, what does this look like when I'm exiting? Can I exit? Can I sell? Or am I locked in forever?
And that's so hard on the women dentists that the men don't have that problem due to culture. I've had women dentists ball in my home for hours because her husband was making $40,000 a year and he got a promotion
And they
and he's got to move from Phoenix to Seattle and he's going to make 52. And she's like, I make 252. I built this practice. It's 8 years old and I've got to swallow my pride and sell my practice and move because low self-esteem, alpha. So do you see that? And what advice do you give on that?
Well, first off, thank you for bringing that up. As a male, I really appreciate that because this happens every single day. I owned over 80 practices in my career, and majority of my owners were women. Probably 85% were women. And this came up a lot where their husband, who was not making any money, did not have a very successful career, demanded that the doc would sell her practice and move, or they were having kids and all of a sudden she needed to stay home with the kids while he stayed out and worked, for pennies compared to what she was bringing in. And so it is really tough. I think the big thing is to make sure that people are having these conversations before they get married and be really open and honest about them. My husband is a dentist too, and he's very successful, but he is very happy being a one doc office, not into scale, not into the big shebang. And he knew where I was going from the beginning. I was very upfront with him. And so, we had the conversations. What does it look like when we have kids? Who's staying home with the kids? Like, if someone has a career move, what are we going to do? And so we were very upfront about that before we ever got married and put it in writing. So that way we stick to it.
I mean, what low self-esteem idiot wouldn't want to marry a rich woman? I mean, what, you hate nice cars and I mean, wow. I mean,
It's totally an ego thing, as you said.
oh yeah. Um, so do you think so when I gotta tell you a story about I was a freshman in middle school in 84 to 87, right? UMKC. And I graduated, I think, in the top 95% of my class or something like that.
That's
Yeah,
awesome.
no, top 95%.
Oh, I get it. Ha 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 ha.
That's a good joke. I stole that from I forgot who I stole that from on my podcast. And but anyway, my gosh, the dean, there was a big deal going on that all the dentists are males and they need to start getting some females in there. And my dean, the chancellor, told him if he didn't have a certain number of women in the freshman class, he was going to fire him and find someone who would. So he didn't make quota. So on the first day, he walked into the hygiene school and said, hey, any of you want to transfer over to dentistry? And he came walking in there with a line of girls behind him and he just moved them over there. And I thought it was great because I thought it was, I grew up with 5 sisters. So I saw the sexism in my own home. I
Mm-hmm.
could go swim in the Arkansas rivers. My sisters couldn't get 10 feet from the edge. They
Mm-hmm.
had to be home when the street light came on. They never cared when I came home. But there were disadvantages whenever, like, mom thought the milk was rotten. She always handed it to me and said, take a swig of that, see if it's rotten. And I'm like, why is it always me? I'm the guy who gets to swim in the river. But do you think it's really changed a lot? The women graduate. I mean, most of the dental schools are over half women now.
Mm-hmm.
And so do you think that changed dentistry?
I think it's changing dentistry. I'm really proud that over half of women graduating or half of people graduating dental school are women. I think that's amazing. We've come a long way there. And I think it is brought a softer side to dentistry, right? When people talk about the dentist, it's the SNL spoofs that you see or the movies where the dentist is standing on top of the guy's chest trying to rip the tooth out or, reading the textbook trying to figure out what procedure to do. And so I think it's bringing a much more compassionate, empathetic, soft side to dentistry. So I'm really excited about that. The thing that I'd like to see the change now is, you know, 30 some percent of all practicing clinicians are dentists, which is great. But when you look at these DSOs, which I think is going to continue to expand in terms of market share, the people leading at the top are all men. So the worker bees, the ones making the billions of dollars for the DSOs are the women. But when it comes to promoting those women into C-suite positions to help run the organizations, we're not there yet. So less than 5% of all C-suite positions in DSOs are men or are women. And that needs to change because just as diversity is important, so is gender. Because if you don't have adequate representation at the top of the people serving your organization and in terms of both employees and patients, you're going to get left behind because you're going to miss out on those key things that are important to those employees and patients.
So I'm asking ChatGPT, what percent of the Fortune 500 companies have female CEOs? And what does ChatGPT say? As of 2024, women led 10.4% of the companies on the Fortune 500 list, making a significant milestone as it is the first time the figure has exceeded 10%. This represents an 18% increase from the previous year.
That's
So it's
huge.
only, so women are half the world's population. They've never been a US president, and it's still 90% male. So
At the top.
so
And
things
that's
change
Fortune
over.
500. I wonder if Chat GPT knows about dental organizations,
Oh, yeah. Let me
I think it's even less.
so how do you want, what do you want me to know? What here,
What
what
percentage of dental corporations are run by women?
currently there isn't specific data available that directly indicates percentage. However, it is noted that the proportion of women in dental workforce and in leadership roles within the field is increasing. But yeah. Well, I got you. So the one thing with the poor women is that their husbands. I mean, gosh, and that's so tough. But another thing, tell me this, true or false. Women dentists always complain to me that our biology and our culture, if dad sits in the chair and says, "Hey, give me a beer," and mom runs and gets him a beer. And when you're the dentist back there and you say, give me a cup of coffee, do that, they just run. Like they've always seen that. And then when she buys his practice, now she's the CEO. She says, go get me coffee, and she's looking at her like, "What do you think I am? Your slave? I mean, why?" Do you think leadership is different? Because dental staff is primarily still almost all women. I mean, I
Mhm.
only had a couple. I had only had two male dental assistants, and one was my son in school. And I never had a male hygienist. So, do you think it's different and harder for women to be the leader in a dental office if all the staff is women? And I used to tell all the women, and I maybe I shouldn't say this on my podcast, but I'd say, well, then stop hiring women if it's
Yeah.
chemistry. And I'd say it's the best luck I ever had was gay males. I mean, they
Yeah.
were so friendly and nice. I'd say start stacking the house with gay males, and and then there's a lot of males, nurses and dental assistants that are dental assistants and hygienists that come out of the Navy and the military. And I said, just start looking for males if that's
Yeah.
the issue. But what do you think that is an issue, and what do you think the solution is?
So I think part of it is I think it looks different, right, between a male leading and a female leading. And I think that the main issue that we have is that as a woman, the majority of leadership that I've seen with my own eyes has been male driven. So when it comes to being a female leader, those skills are different than having a male leader, but yet I've never seen that in order to model it. Does that make sense? And so I think they confuse that with saying, oh, leading as a female is harder. There's definitely challenges specific to being a female leader for sure. And you kind of talked about women leading other women, how it could be, quite catty. But then there's the opposite thing. And I've run into this as well, where I've had male associate doctors or male staff members who don't want to take orders from a woman. Right. And so I think it's really important to not play victim in the beginning. Try and figure out really good tools and skills that you can have as a woman leader and try and hone those skills. Find another woman leader that inspires you and that does a really great job. Watch them, study what they do, and mimic that. And I think that's what we haven't had in the past. But then the other thing is like, and you and I were talking about this before we got on. People are people, and we're continually disappointed by people, right? That's the human race. And I think regardless if you're a male or a female and you take over a practice, you might have to turn over that entire team to find a team that resonates and that you have chemistry with, whether it's male or female employees. So I think it's more about chemistry, having confidence in what you are as a leader, and then finding someone's behavior to model.
And last question about DSOs. What advice would you give to all the CEOs of DSOs? They've all been on this podcast. I know they all listen to it. What would you recommend to them to reduce their employee turnover? They're dentists, not employee turnover. They're dentist turnover. And let me be fair. In private practice, it's the same problem.
Yeah.
In my 30 years, they either were with you 7 years to almost life, 7, 10, 50. They were long term or the rapid turnover. And the rapid turnover was usually in the first year or two. And
Yeah.
I think about half and half. So we had a lot of turnover in the first year when everybody's realizing it's just a wrong fit. And then if it was a nice fit, they lasted a really long time.
Yeah. I think two things are really important. What I'm seeing is that, the big conglomerates that are out there are only getting bigger, right? They're not shrinking. And the bigger they get, the more corporate they're becoming. And they're really forgetting about the small business owner who is their individual practice. And that feels very to the dentist, it can feel very corporatized, and it feels like you no longer matter. You're just there putting cheeseburgers in a bag for the big franchise, right? And so I would encourage the CEOs of big DSOs to not get too far removed from the core business, which is the small dental practice, neighborhood dental practice. The other thing is that as they continue to grow, it's really important to ensure that you build a clinical representation along with your business or clinical representation along with your business representation. So in my experience, what I have seen is that, as DSOs tend to grow, instead of having an arm that grows clinically and then an arm that grows business, the arm that grows business, grows tenfold, and they don't do anything to make sure that the clinical side is going with it. And as a clinician, when I work for a DSO, it's really important to me and to other clinicians, you're one yourself, to make sure that clinically, we feel like we're doing the right thing for the patients and that our clinical expertise is appreciated.
And then here's another beef I have with companies. Henry Ford built the entire car at the Ford deal. I mean, he was hands-on. Mr. Honda, read his autobiography. He lived in the plant. In fact, the funny story about Mr. Honda is if the assembly line stopped, alarms would go off, and he would run down there. One time he ran down there in the middle of the night. He was obviously sleeping in his birthday suit, and he reworked the line for an hour and a half completely naked. And I think he was in his 70s. And I grew up in Wichita, which is a big Boeing center. And Boeing, when I grew up, Phil Conda, the CEO from 1996 to 2003, he was a mechanical and aeronautical engineer. Alan Moley, who was CEO of Boeing from 2001 to 2006, again, aeronautical engineers. And I don't know, I'm calling me old school, but shouldn't the CEO of Heartland Dental, Rick Kirshner, be a dentist? He is. Shouldn't the CEO of Comfort Dental, Rick Kirshner, a dentist? I mean, should we really have marketing managers and accountants and Wall Street people being the CEOs of these DSOs? That doesn't even sound.
I mean, I think there is value in having, some business people be CEOs, but then let's also have a strong team of clinicians that are C-suite people as well to help drive the decisions that the business side is making. I think that's what I'm trying to say is like, for every business ad, we do a clinical ad, right? To make sure that we're in alignment. Because even when I scaled and I was running all those practices in the States, I still practice full time in my office in Aurora, full time, because I wanted to keep my hands wet. I wanted to keep my legitimacy. And I wanted to be able to say to that doc who came to me whining about, I can't lead my team because I'm a woman. I could say, wait a second, you can. Let's help you develop your skills so that you can lead your team. And so I think it's, to my point, I don't want the CEOs of these organizations to get too far away from the
Well, look
day-to-day
how
core
far away
business.
Boeing is. Look how far away Boeing is. I mean,
And
it's
that's when mistakes start to happen, right?
oh
Like they're
yeah,
having all
yeah.
kinds of stuff
I
happen
just,
right
I
now.
mean, I mean, dentistry is so controversial among dentists. I couldn't even imagine being an outsider to walk up to that party from Wall Street and say, "Oh, let me weigh in on root canals, fillings, and crowns." And it's like you can't, you could barely get the dentist to agree that today is Monday,
Yeah.
and you're going to come to us from another field. I mean, I
Yeah.
good luck with that. Um,
I will say that, like, for the young, back to your question earlier about the young dentist coming out of school and joining a DSO, I do think there is extreme value in joining a DSO for a new grad for just, even if it's just a couple years, because they get that community and that camaraderie amongst the dentist. And so when you're coming out of school, you know nothing, which I'm sure the new grads are not going to be happy with me saying that, but they need a lot of mentorship and guidance. And being in a DSO, you're automatically connected to all the docs in that DSO that you can team up with for mentorship. and community, which we know the Gen Zers nowadays love community, right? So I do think that there's tremendous value in DSO for that reason.
So your book is really amazing, but reading your on your website, which is what is your KatieLeeDDS.com.
Yes.
I mean, God, it's sad. At the age of 14, I was in a traumatic ATV accident that left me beat up, bruised, and scarred. I spent nearly a week in a coma and had plates, screws, nuts, bolts, and wires holding my face together. I endured 9 surgeries, including rebuilding my jaw from my rib and dental implants. It was a painfully long process. It took years. My gosh, what did that do to yourself? So you were missing your front teeth in high school,
In
right?
high school, and I had I was missing my teeth, and once I got my wires off, I couldn't open my mouth whatsoever. So that's where all the additional surgeries came in. And so I had to wear flippers to replace my front teeth, top and bottom. And as a high school student, sometimes I would get up and go to school and forget my teeth. And so I'd turn around from my locker in the morning, flash my big smile to my junior boyfriend, and he'd be like, "Katie, you forgot your teeth." How mortifying is that? And, I couldn't eat lunch in the cafeteria with everybody else because I didn't want to take my teeth out to eat. And I had to do that for 4 years before I could get implants. And so these days, when patients complain to me about wearing a flipper for 3 months waiting for an implant, I'm just like, you know, let's not go down that road because I got you beat there. So yeah, I mean, it was horrific. Really affected my self-esteem, affected my mental health, changed my personality a bit. It took me quite a long time to dig out from that. But dentistry, I remember my senior year when I finally got my dental implants right before prom, and I could go and smile, and it was life-changing. And my dentist, he's the guy that I said I was going to take over his practice when I graduated. He's the reason I went into dentistry. Nick Burns is his name, from Watsika, Illinois. I just talked to him a couple weeks ago. He's amazing. He's actually inspired, I think, 5 dentists from our small town, 5 females from our small town of 5,000 people to be dentists. He's just a remarkable man. But he really was so empathetic and helpful along the way. And like, when I would come into his office, crying and in pain and all this, because obviously my teeth were just wrecked, he just had so much patience and grace for me and did whatever he could to help. And then he gave me a job at 16. He didn't need to hire a 16-year-old, but I was there spraying weeds in the back with Roundup, which I wish I didn't do. And filing charts and, cleaning the lines and stuff like that. But he got me exposed to dentistry, and he's the reason why I wanted to be a dentist, was because of him.
But again, how did the trauma take you from wanting to be a dentist to the oral systemic link? I mean,
Yeah,
what's
great
the
question.
connection there?
Yeah. So, the night of the accident, when I had lost a bunch of teeth, obviously I had broken a bunch of teeth, and they wired my jaw shut right there in the emergency room. And so over the next 8 weeks, when my jaws were wired shut, all I could eat and all I did eat was ice cream with chocolate syrup, boxed mashed potatoes, jello, and pudding. My family, we obviously didn't get the education on nutrition. And so that's what I survived off of for 8 weeks. And during that time, obviously the broken teeth I had started to decay. So I started to get dental infection and pain, but no one could do anything because my jaws were wired shut. And then I became emaciated. I was under 100 pounds. My kidneys started shutting down and my liver enzymes spiked. And I remember being taken to the doctor and everybody was freaking out. And that's when they started doing, IVs and giving me some nutrition counseling and stuff. So I learned at a very young age how important your oral health is to your overall health. And even though I knew it, it still took me a little bit for it to really sink in about how much the mouth affects, almost every organ system in the body. So once I became a dentist, I just started diving into more and more research about the microbiome, pairs of teeth, chewing, mastication, airway, all this stuff. And because I've lived through it, I know how important it is for people.
So where do so what is where's your journey now with the oral system
Yeah.
systemic link?
Yeah, so I sold out of everything in January 2023. My plan was to take time off like you did. But I have a hard time sitting still, so I had a baby and then I wrote the book last year. And now I'm in the middle of opening up an oral systemic health clinic here in Denver. So it's a really big center, 2 stories. It's going to have dentistry, medicine, education, sleep, all of it. So hopefully
Wow.
that'll be here
So
in 2025.
now it's funny, there's some words that are so controversial. One of them in America is socialism, and I actually think that a lot of people in World War II, Germany, what was the German government? The National Socialistic Government, you know what I mean? So I don't, it just got it's such bad. But whenever you start putting things together and say holistically, mouth, eyes, body, diet, oh my God, that triggers so many crazy right-wing dentists like, oh my God, she's holistic, she's a nut cake, she's a fruitcake. Is there a less triggering word for socialism? And it's funny that people always say socialism, they're on Social Security,
Yeah.
they're on Medicare. It's like, oh, so socialistic retirement and old age income. It's good. That's good socialism. But is there a better word for holistic so it doesn't trigger all the old dentists like me who think that that's just a bunch of crystals and all that kind
Yeah.
of.
Yeah, I really think of it more as like integrated health, right? And where this concept came from was, when I was in my office, I would do saliva tests for patients, and I would see that they had heart disease and diabetes, or that they had Alzheimer's in their family, or they had an airway issue, and I would say, okay, here's a referral to your doctor. I need you to go get these tests or go see your doc to manage this better. And they would say, I don't have a doc, or I don't have insurance, or I can't get in for 6 weeks. Can you help me? Or more than my medical doctor, which obviously I don't, but the perception was that in some cases. Um, and so I just really started to feel bad for my patients, because here I am as a dentist talking about the whole body and integrated health, but I didn't have that other side to care for the patient. So I felt like I was stirring up this anxiety about how the oral health was affecting their systemic health, but then not giving them any tangible solutions. And so I thought, why not just put it all in one area? And Pacific Dental Services is doing something similar. They're integrating medicine into their DSO, which is cool. But my approach is different. I agree with you when you say holistic. People think natural. We're going to be chewing charcoal or oil pulling and all that stuff, and that's not my approach whatsoever. It's more of a midline approach that's scientifically based. Of course we're not going to use harmful chemicals that there's lots of research on, but we're also going to take a moderate approach to integrated health.
I want to say something about the MDs. Incentives matter. I was saying I think their employee turnover would drop drastically if they would just give stock options instead of I'm buying in a minority partnership to this one dental office. That's
Mhm.
a very illiquid asset to me. It could be much better. But when I incentives matter, for the MDs where I was, I mean, they can only spend 10 minutes each patient there. They MDs can't sell their patient charts because if you open up your practice and you're a provider, you're already booked out 3 months in advance. So they can't sell any of those bills to patients. But I found much more success. I made sure that every doctor was invited and pharmacist was invited to my house, and I had benefits of naturopathic medicine, and then I did podcasts with them. I did the I do Dentistry Uncensored. I did Awatuki Uncensored. That was the community in Phoenix that I live. But man, every single chiropractor, I think it was 13 out of 13, came over and did it and was all grateful, but only like a couple MDs. And oh my gosh, what was the other ones? Um Lose Weight with Dr. Noel, DC. What was some of the other big ones? One was affiliated dermatologist. The dermatologist came. Um, let's see there. What was the one I was looking for? Oh, pelvic health with Kim Bryan. I didn't even know what pelvic health was. I'm a guy and I found it very interesting, but I would and then the pharmacists were the most important. I would always go by the pharmacist because people always walk up to him and say, what do you recommend for a toothache? Would you recommend Bufferin or aspirin or Ambisol or whatever? And I would just tell him, just pick up your iPhone and FaceTime me. I
Yeah,
mean, I'm in my chair, and my gosh, the pharmacists were good for a toothache. I would go to the emergency rooms and say, hey, you know what you should do with triage? You should say, if this is a toothache, here's some cards for a dentist who will see you right now, right up the street.
totally.
Dental. But man, the MD seem to have the biggest egos.
Well, and you know
And,
what that is? It's lack of knowledge. So what I found, because this whole time, that I wrote a book and I'm building my center, I do a ton of podcasts now. And actually, when you mentioned pelvic health, I kind of chuckled because my number one podcast that I do, at least once a day, I'm on a fertility women's health podcast once a day. And they're so into oral health fertility connection. It's crazy, the connection between oral microbiome, fertility, and vaginal microbiome. It's wild, but I haven't had success tapping the MD market, is what you're saying. So I've had really good success with functional medicine doctors, diabetologists, cardiologists, brain health people, but the not run of the mill, but the, everyday uh private, or not private practice, but family medicine doc, I have not been able to crack them. And every time that I talk with them, the root of it is just lack of knowledge, and it comes across as ego, but I think they just are afraid to get in a conversation that they can't contribute to in a meaningful way. And we got to figure out how to crack that as dentists, otherwise we're never really going to integrate into health.
yeah, and again, they have unlimited patience. So I would look for your area who's advertising. If they're advertising, they want new business, and none of the if they take Medicare, Medicaid, and all the insurance companies and they're a family physician, none of them want a new patient. But man, if any healthcare provider is advertising in your neighborhood, I was the first dentist at Walgreens to go over there and set up a fax machine so I could fax the pharmacist the prescription so that when they got there, it would already be filled. And then that was then Walgreens, when they found out about that, they made us take it down. They said that was not cool. I don't know what it violated, but they certainly didn't like it. But yeah, I would not work with anybody and like cardiovascular surgery. I mean, that fee's $100,000 for a bypass. They're on billboards, they're on everything. You can get a cardiovascular surgeon to come down on your podcast, but not an internist or
Yeah, so I am going to be working with a cardiologist in my office. And if you think about it, why would you ever undergo $100,000 life-saving procedure if you have PG and FN and TD and AA bacteria in your mouth that we know colonize the heart and cause heart issues? Like, that's just wild to me that people would undergo a procedure and not have their microbiome tested beforehand to ensure success. Same with joint replacements. We forever people have known that they need to take antibiotics under certain joint replacements when going to the dentist, because we know that the bacteria in the mouth can colonize on the joint and cause the joint to fail. So it's crazy to me that they would do a joint replacement surgery without first testing the microbiome to make sure they're clean. So yeah, that was on a soapbox there a little bit, but I'm trying to reverse that kind of thinking.
Well, if people are listening to you, and I mean, what you're doing and what you're doing is amazing, but you're
Thank
about to
you.
build those big. But if someone's listening to you and wants to know more about all your health, is it go to katieleedds.com?
Yeah, so you can go to katieleedds.com. I'm on Instagram, same handle, katieleedds. Really good at answering Instagram messages, or they can email me at katie@katieleedds.com. Try to make it super simple for everyone to reach me. I'd love to chat with more people if they have only positive. If you have ideas or tips for me, I got so many tips from you tonight. I have a whole page of notes actually, so thank you. I feel like this was a business session for me. And so, yeah, if anyone has any ideas or tips or questions, or if they want salivary testing or, questions about the book, please reach out.
Well, if they wanted to know, well, first of all, on oral systemic health in your practice, what do you think are the best technologies? I mean, like if I go to McDonald's, it's a Big Mac frying a Coke. What's the Big Mac frying a Coke? Probably a bad analogy for oral systemic health on a dental podcast. But the main thing. What are the main technologies that really got you excited that you can't live without, and you think dental offices should be doing?
Yeah. So the number one thing is you got to test the saliva, because we have to know what's in there. Saliva can tell us so much. It can tell us if you have bacteria causing bad breath, if you have bacteria causing gum inflammation, if we can measure enzyme markers to tell how much the bacteria are getting from the mouth into the body. We have those same enzyme markers tell us if you're developing leaky gut. Um, if it's affecting your heart or diabetes or Alzheimer's, any of those things. And we need to know what bacteria are there, because they're all treated differently. So we've made the mistake in dentistry in the past, because we didn't have any objective tests of treating, gum inflammation all the same. And what we had was these patients continually coming back, not getting better, and just saying, my gums have bled my whole life. This is how I am. Well, that's actually, not true. We can fix that now. And so saliva test is number one for multiple things. You can test vitamin D levels, all sorts of stuff. Second thing is to get a cone beam.
Wait.
Yeah.
Well, how do you test the bacteria? Is there what test kit you recommend?
Spit test. So spit test, there's lots on the market. I use oral DNA. They're a good one through Access Genetics. There's HR5 through Direct Diagnostics. A new one that I'm really liking is Bristol Health, because they test a lot more than just oral microbiome.
Okay,
So
oral DNA. What was the second one?
HR5.
HR5,
Yep.
which you said was owned by what?
Direct Diagnostics.
Direct Diagnostics. And then what was the last one you said?
Bristol Health.
BRISTOL
STLE.
STLE.
Yes.
Bristol Health. So those are your three: oral DNA, HR5, Direct Diagnostics, and Bristol Health.
Yes.
Okay.
I also like the enzyme test I was talking about and that I reference in the book all the time is it's from Dentignostics. It's like a Dento, DENTO, GNOSTICS.
One word or
One.
dento
Gnostics, like diagnostics, but it's Dentognostics.
Oh, Dentognostics.
Yeah. So I really like that one because it's the MMP8 enzyme, which is a collagenase enzyme that breaks down collagen all over the body. So everyone's obsessed with taking collagen supplements. Yet, if we could just prevent our collagen from breaking down, we'd be a lot better. And what's nice about that test is it's actually 18 months predictive of future collagen loss, not only in the mouth, but in the gut. That's what causes leaky gut. That's what causes our arthritis. And we can see this before you can see breakdown on x-rays. So x-rays are a very reactive diagnostic tool, right? We have to see something wrong in order to diagnose it. MMP8 tells us something's happening before it's visible, which is awesome.
Okay, so testing saliva is top of your
Saliva.
list.
Next thing
what?
would be a cone beam CT. Everyone should be getting a cone beam CT. Our teeth are three-dimensional images. 2D imaging is a thing of the past. Sure, it's great for finding cavities, but we need to see, are there chronic abscesses going on that we need to treat? CBCT is also great because it lets us see airway volumes. We can screen if a patient is, prone for sleep apnea issues or airway issues. So I would say CBCT is another
I
one.
remember one of my patients way back in the day, Gordon, was a ENT. And he asked me to come look at this patient, and he was looking up there, and where the root was in there, just pus, and it was a failing root canal. And now I know some Jason Hale in Mesa, endodontist. Oh my God, he works with an ENT guy. He cannot believe how many failing, and they don't hurt or build up or
Yep.
bad because they're just draining pus into your
Yep.
sinus, but only
Yep.
for 10 or 20 years.
Yeah. And people say, oh, I have chronic sinusitis or, I have a sinus infection. And it's like, no, you have a tooth problem. You have a dental problem. And by the way, your sinuses are right next to your brain. That's not good,
So spit test, cone beam CT, what else?
Oh my gosh, there's so many out there. I'm really loving the dental AI that's coming on that's going to be helping, new grads diagnose better because I think they're always, especially coming out of COVID, I think they're really timid on diagnosing. I love, oral cancer screening devices.
Well, wait, on that dental AI, there's only two main ones I can think of. What are you thinking? Which
The
one?
one that I like, and it's only because it's like the only one that I've worked with, so I wouldn't take my word on this, but like Pearl is pretty
Yeah,
great. Yeah.
that's the one I podcasted.
Yeah.
What's it called?
Pearl AI.
Pearl AI.
Yep.
But who has the best AI in dentistry? Should we tell
No.
him? Should we tell him? Oh my God. Um, we started Dental Town in '99.
Yeah.
And it's 2024. When you have Facebook groups and all that, you can't scrape the data and the message, all that. So we have an AI team and led by my son Ryan, and they've been working on it for a long time, and it is flipping amazing. You're going to be able to ask the question on dentaltown.ai or dentaltown.com/AI, doesn't matter, but it's going to tell you what 250,000 dentists have been saying for 2.5 decades
That's
in
awesome.
millions of posts for
That's
two
amazing.
decades.
That's
And
awesome.
you look at these questions on Reddit or Facebook group, all these lame amateur questions, which is what you'd expect for a dental student or first couple of years
Yeah.
out. And they're getting these little one-line answers, and we can give you, and in fact, you can even say on the dental line, answer it in 20 words, answer in
Yeah.
200 words, write a book on it. I mean, what create a lecture with slides on it. I mean, it's gonna, yeah. So dental AI is gonna be, and I
I
love
love
Pearl.
it.
But
And
Pearl,
then,
he was telling me that AI, he loves the AI on the images for the X-rays and
yes, that's what I'm talking about. Yeah.
but this is
The
going to
health and
be, but
diagnosing.
we're going to have Dental Town AI for dental knowledge. But anyway, so
That's
what was
awesome.
the next thing you said?
So I also love, and I haven't mentioned this yet, but I think every single patient, not every, 85% of patients need to be screened for sleep apnea and do a home sleep study. I can't tell you how many patients came into my practice for years and they were grinding the crap out of their teeth. They had acid reflux, high blood pressure, collapsed VDO, and I would throw a night guard in their mouth and they'd be back a year later with holes chewed through it. And I'd make them another night guard, because I didn't know better. And then I started getting educated in sleep and just understanding that sleep is a major issue. And 70% or 75% of people that have sleep apnea are undiagnosed. That's wild. 80% of the population snores. And, obesity is a big thing in this country. 85% of people who have diabetes also have sleep apnea. And access to care for sleep apnea is so limited. My dad's trying to get a sleep study right now, and he's booked out a while to get a sleep study, and it shouldn't be that way. And so, I think with the advent of home sleep tests, patients can get a home sleep test sent to their house. They wear it in the comfort of their own bed. A lot of them are disposable now these days. They can throw them away in the morning. A board certified sleep physician reads it and then will tell you if they have a sleep problem. Because as a dentist, if someone's breaking the crap out of their teeth, they're also going to break the crap out of whatever you put in their mouth, be it crowns, veneers, whatever. And then we're stuck in the situation of having to redo our work for free because we have the wrong diagnosis, right? We did a treatment on the wrong diagnosis. So if we can correct airway, not only will we reduce the chance of heart attack and stroke, will reduce, also brain damage and dementia, but then it'll make our work that much better and last longer.
Yeah, it's amazing. I loved wrestling. I mean, I was third. It was my grandpa Czech, and then me, then my four boys. Now my grandson is in it. It's 4 generations. But one of my biggest heroes, Brock Lesnar. I mean, every time he wrestles, I mean, his bottom teeth are just worn flat. I mean, just have you seen those? I mean, I couldn't. It'd take a power sander. But I was wondering. Obviously, you look at that and say, okay, he's grinding his teeth. What for these young dentists? You said you 85% get a sleep study, but what are telltale signs that they can recognize from a patient in the chair after a new patient exam that thinks maybe Katie's not sleeping well at night?
Yeah. So many signs, like, and once you know this, it's like you can't unsee it. And then you just start freaking out because you think all your patients have airway issues, and probably most of them do. So a telltale sign is like just generalized wear for sure, pretty severe wear. But if someone has really no wear on their back teeth, but a lot of anterior wear, what they're doing at night is because they can't sleep, they're protruding their lower jaw forward to try and open up that airway to breathe. So anterior wear is a big one. Acid complaints of acid reflux or bad breath. That's a big one. So if I see anyone on, medical history that's on Prilosec or some sort of GERD medication, I always ask about sleep. Um, you can always ask people if they're tired. They're always going to say yes, but then they'll have a but following it. Like, yes, but my job is stressful, right? But I have kids, when it's usually an airway issue. Postmenopausal women should always be screened. So what happens is, postmenopausal women, we lose a lot of our bone density. Obviously, our muscles and tendons and everything are attached to our bones. So when our bones start to disintegrate, all of that tissue starts to sag. And so a lot of really thin postmenopausal women will have apnea. If anyone is on 2 or more blood pressure medications, that's a trigger for apnea. Diabetics, like I said, 85% have apnea. So anyone on diabetic medication, I would screen. And then I would always teach my docs, if you're going to put a night guard in someone's mouth, unless they're 20 years old and seem perfectly healthy, I would do a sleep study ahead of time Because if you put a night guard in someone who is borderline apneic or who is apneic, you're shortening the tongue space and you're going to make apnea worse.
Okay, I don't mean to be crass or crude about the almighty dollar. You know, a lot of people say money's the answer. What's the question? But I know she's hearing you. I know my homie. She's saying, "Look, I got $300,000 to $500,000 student loans. I just bought a practice for $1 million. I just bought a house, and I'm pregnant with my second kid. And if I do extract a tooth, do an implant in the crown, that's $3 grand. If I take a toothache, root canal, Billum crown, that's 2,500. I do Invisalign, that's 5-6 grand. Is there any money in this oral systemic link stuff, or is this?" Is this good from the heart, like public health dentistry and everything, but I'm never going to be able to pay off all my bills with this.
Yeah, so I am going to talk about money, but I don't want people to think that I'm doing this for money. So I want to caveat that I'm doing it obviously because my history and my past trauma, which is what led me in. But in my experience, talking about money, connecting the mouth to the rest of the body adds legitimacy and urgency to the dental diagnosis. So now all of a sudden, whatever you tell your patient to do, they will do it because you have that medical dental connection. So just like when you go to the doctor, right, and the doc tells you need a bypass surgery, you don't say like, no, I can't afford it. I'll be back in 6 months, right? Or can I do a payment plan? Like, no, you schedule for the bypass surgery tomorrow if you can. But in dentistry, it's not fitting into my budget, or I got to ask my spouse, which really those are cues for, I don't really believe what you're saying, or I'm not buying it, or this isn't a priority for me right now. But when you start to link and have data and you use technologies to prove to the patient that they have an issue and it is affecting their overall health, all of a sudden it becomes super priority to them and they want to do whatever they can to fix it. So there is a lot of money in this.
Okay, and my last question, I can't believe we've gone over an hour, and I always try to keep it an hour because when they see like when I did Carl Mish, it was 3.5 hours, and people just saying I still haven't found the time to commit through. But anyway, well, I got two last questions. I'll ask you a question, then I'm going to ask you for a close on something else. But new dentist education. How would you coach her to ramp up production, patient communication, team development skills, proper diagnosis treatment planning? I mean, they just got out of school, but they got so far to go. How would you coach ramping them up so they can get to full speed faster?
I think the mistake that a lot of dentists make coming right out of school is, going after education that's shiny, so fun, like let's do veneers, let's do implants, let's do Invisalign. And the thing is that you're never going to be able to get to that spot to do those procedures if you can't communicate to the patient that they need it done and if you can't diagnose it properly. So I tell patients right out of school, the only thing that you should be a student of right now is diagnosis and treatment planning and case conversation. Once you can nail those two things and you're looking at your case acceptance rates above 70%, and you're cranking out more than $3,500 a day, with, those are insurance fees. Then I would start looking at doing those bigger shiny procedures. So you got to crawl before you can walk. And I think a lot of docs coming out of school don't realize that. And they have so much debt, but then they'll go spend another 10 grand on a veneer course, but then they can't go back and diagnose or convince their patient to do the veneers that they just learned about. So then that skill that they just learned atrophies, right? If you don't use it, you lose it. And so I always tell people, find a mentor, find someone that you idolize, as a dentist, right? Who's super productive, who's really successful, or who is mildly successful but seems low stress, or who has a good team, or whatever it is. Find that person and latch onto them. Dentists, we love to mentor other docs, so we love to, feel appreciated and needed. And do whatever you can. Every free moment that you have, you should be locked to that dentist's side, listening, watching, studying, taking notes, and trying to mimic what they're doing. Don't try and reinvent the wheel. Follow those, stand on the shoulders of giants, as they say.
You can always tell a genius dentist, I'm not blowing smoke, is you ask a dentist, you always know the bottom tier. You say, well, what's the biggest problem in your practice? Well, I have a hard time finding MB2s, and they say they all have an MB2, but I only find them half the time. It's like, dude,
Yeah.
if that's your biggest problem, because the biggest problem is always going to be people. It's going to
Totally.
be just like you were turnover at a DSO, your own staff's turnover, your own patient. I mean, I've told everybody for every year, so just do the math on your hygiene. I mean, if a patient comes in and has to have their teeth cleaned just every 6 months, nothing sooner than that, and your hygienist works 40 hours a week, 50 weeks a year, that's 2,000 hours. You could only see 1,000 patients, and then you have no openings in your practice, but you've had one hygienist for 40 years and you get 30 new patients a month. I mean, it's like a coffee cup, and they've been pouring coffee in this cup for 40 years, and the patients come in the front, they go out the back, the staff turns over, and they're at a TMJ course.
Well,
And,
yeah.
you know,
And I'm so glad you brought up hygiene, because earlier when you were asking me if is there any money in oral systemic health, what I was seeing in hygiene, especially through COVID, because there was a great resignation of hygienists during COVID. They all left the profession. And so what happened was the ones that stayed all of a sudden started demanding outrageous wages to pay. I was paying someone $35 an hour plus production. It jumped to 55 overnight plus production. I've seen on Cloud Dentistry, they're asking for $85 an hour for a temp hygienist. And what happens is if you're taking insurance, you're getting less than what you're paying your hygienist per hour on a prophylactic cleaning. If you're an HMO, you're getting nothing. And so what happens is hygiene starts to be a massive drain on the financials of the practice. Well, if you start incorporating oral systemic health and your hygienist is doing this saliva tests that are coming back showing the patients you have an oral infection that is tissue invasive, resistant to mechanical cleanings. Not only do we need to do scaling and root planing, but I need to do these adjunctive services. All of a sudden, now your hygienists are out producing your associates, which was the case in my practice. So,
well, I'm gonna let you take away the close. We went over an hour. In fact, we went way over hour 10. But I just want you to close again with that young dentist, couple of years out of school, student loans. They don't know if they should open up their own practice, or they're afraid. They're just living in fear. Life is an attitude. Take it away and close. Talk to that dentist.
yeah. So life is an attitude. You're right. Stop sulking in the corner, get to work. You got a lot of debt to pay off. I would also say don't worry about the debt. It's good debt that you have. It's not like you have credit card debt. So no one's going to look negatively on that debt that you have, but it's time to take it seriously and figure out how do we be successful. I would not open up my own practice right out of dental school. Now looking back, it took, they say it takes 10,000 hours to be an expert at anything. That applies to dentistry too, at least. And so you're going to have a good 3 to 5 years of a rough go. Dentists will always tell me they're anxious, when does the anxiety stop? And I say, it takes about 5 years before you stop freaking out every day in the office and you get comfortable. And so, I would say don't open up your own practice because number one, you don't know how to be a dentist yet. Number two, you don't know how to lead a team yet. And number three, you don't know how to run a business. So go join another dentist that you think is great. Go join a DSO where you can have an automatic community. Learn as much as you can. Walk before or crawl before you can walk before you run. Once you feel like you get a good grasp, then you can go and do whatever you want. But that's the advice I would say.
Well, Katie, thank you so much for all that you've done for dentistry,
Oh,
and
thank you.
look at your attitude. I mean, most people that went through all that dental trauma would have never gone back to a dentist again without having to be put to sleep. But you spun that around and said, I'm just going to be a damn dentist.
I'm
I
just going to
mean,
do it.
and unbelievable. Thank you for all you do. Thank you so much for coming on the show. It was an honor to podcast you.
Thank you for having me.